I'm Amelia Brown. In this video I'm just going to demonstrate the skills of triple airway manoeuvre, starting an oropharyngeal airway, a nasopharyngeal airway, using a laryngoscope to inspect the patient's airway, assisted positive pressure ventilation, just aiming for 12 breaths a minute, and putting a patient in a lateral side position. In this video I'll have the standard precautions of gloves and goggles. So to do a triple airway manoeuvre on an adult patient, you just want to put a pillow under the head to keep the airway as straight as possible. For the head tilt, you just want to tilt the head back. For the chin lift, you just want to put hand under the mandible, gently, one hand on the forehead, one hand on the chin, and just want to gently pull upwards. For the jaw thrust, you just want to put fingers under the mandible, careful not to get on the soft tissue, and just tilt upwards and thrust the jaw forward. So for an oropharyngeal airway, just want to measure it first. So put the flange to the lips and measure to the angle of the mandible. So you just put it in upwards first. Just open the airway. And when you get halfway, you just turn it 180 degrees and push it all the way in, and just rest out on the bottom of the lips and careful that it's not pinching the lips. So this is just to keep the airway open, patient, and keep the tongue from occluding the airway. You don't use an oropharyngeal airway on someone who's got trismus or has a present gag reflex. So I'm just going to demonstrate how to put a nasopharyngeal airway in. So to measure this, you measure from the flange of the nostril to the bottom of the earlobe. You just put some lubricant on this, and then you just select the widest nostril you can see. Just gently and rotate it slightly. You only need to insert it as far as it can go. It doesn't need to be at the bottom of the nostril. Contraindications for the NPA are on patients with middle third facial fractures, because you can actually puncture through the brain. This is used on patients who have a gag reflex present. I'm going to demonstrate how to do assisted positive pressure ventilation on a patient who's breathing inadequately. So you just get the mask, the bag valve mask. Just put the mask over the patient's nose and rock it side to side to ensure you get a good seal. Just put your thumb over the top of the mask and your fingers under the patient's mandible. Careful not to occlude the soft tissue. So you just put one thumb over the one side of the mask and the fingers on the other. Squeeze. So you're aiming for 12 to 16 breaths a minute. You want to deliver 10 mils of oxygen per kilo. Common issues with assisted ventilation are over-ventilating the lungs. I'm going to demonstrate how to put a patient into the lateral side position. So it's just used so the patient's airway remains painted and they do not asphyxiate on their own fluids. So to do this, you just put the knee closest to you, bend that. Just put the patient's arm outwards across their chest, and you just gently, before you turn them, you just quickly check their pockets, make sure there's no sharp objects. To do this, you just put one hand under the shoulder and one hand on the knee, and just rotate them. So you just put the patient's arm out closest, and just put their head out forward and resting on the floor to make sure that anything in the airway will drain out.